afternoon. Hello, podcast viewers and listeners. I'm your host, Marilyn Santiago, and today we will continue with our latest topic on adult ADHD. We're going to cover some of the techniques and strategies, tools that we have available to manage adult ADHD. We will also discuss what services Harmony United Psychiatric Care provides to its clients that have been diagnosed with adult ADHD. Again, today, we have Melissa Tamayo, our physician assistant and operations manager here at Harmony United Psychiatric Care. Welcome again, Melissa. How are you?
I'm doing well. Glad to be back.
Thank you so much. So today I'm going to ask a couple of questions on strategies, techniques, and for adult ADHD, how to manage. And to start, let's start with mindfulness. So, what medication or mindfulness techniques can you give us, right, to manage our condition, our adult ADHD diagnoses? What can we do to better manage adult ADHD?
That's a great question. Obviously, we're looking at things outside of medication. So when we look at mindfulness, we're looking at different meditation techniques. So one of the things that becomes really important is something as simple as breathing, which we kind of take for granted, but it's a good tool to have to reduce stress and doesn't take much and can be done at any time. So a lot of times we just have to kind of focus on our own breathing, try to anchor ourselves a little bit. And in focusing on this, you can kind of reduce some of the external stressors that you're exposed to. It becomes quite beneficial, especially when you're in a pinch and you're feeling kind of that stress build up. That tends to cause a lot of that lack of focus. That tends to cause a lot of that just kind of feeling distracted, and that can kind of recenter you again. So mindful breathing is something that's very simple, but yet really important, and something you want to keep in mind to utilize if you're feeling kind of that stress build up. The other portion we've talked about before in several other panels as well, but still stays true to this one, is exercise. So mindful movement, if you want to put it that way. Obviously things, especially that include meditation. So when we're looking at like Tai Chi or yoga, these become important again for the same factor that they help you kind of focus a little bit more on yourself, on your body, on how it's moving, and helps you kind of center again. So these become kind of a great meditation option or technique to try to improve the symptoms of ADHD because they reduce stress. The other aspect was actually the last thing we talked about was just your eating patterns and just being a little bit more paying attention to the types of foods you're eating, how they may play a role into either helping you focus or making you not focus as much. So just being a little bit mindful. We tend to also have the tendency, let's say, to get anxious and overeat. Yes. or look for the sweets, to give us that false energy. And although they do give us a little bit of a rise in energy, we know that it quickly falls and it crashes, and then you can see kind of the energy and the focus, lapse from there. So those are things you want to keep in mind. So moving, breathing, eating patterns become important. The last part of it is something we always educate the patients a lot on, is just being mindful of kind of your tasks for the day, being realistic with them. So mindful with your task engagement, that we call it. So essentially it is making a realistic to-do list, trying to stick to it, revert back to it constantly to make sure that you're getting done what you need done. And if you do get sidetracked, you can kind of recenter yourself again and get back on track on a reasonable time basis.
So on a person that is multitasking every day, either at work or at home, because at home you have the children, you have the husband, or even if you don't have the children or the husband, you probably have the pet, right? Or you have a home that needs to fix, that has projects, right? These could be triggers to a person diagnosed with ADHD, to an adult diagnosed with ADHD, because of the responsibilities. So the importance of having a realistic list, I get, but what happens when you have two things at the same time, either at home or at work, right? How can we just say, you know what, let me separate myself for 5 minutes, right? From this. What can I do when I separate just to refocus? What can I be doing? Do you think the breathing exercises could help a little bit? Because we would get antsy, right? That anxiety piece. Oh my God, I'm not getting these two tasks done, at work or home, whichever the case might be. And we get that anxiety and that level of anxiety, and it triggers, we totally lose control of our focus. What
Mhm.
else, other than the breathing techniques, right? What else can we do to step out, and how can we regroup, in less than 5 minutes, and be able to focus and go back again to our task without feeling that pressure of that
Yeah.
failure pressure? You know
Yeah,
what I
I
mean?
think, and it's as easy as that. I mean, even if, let's take the scenario that you had where you're at home and maybe you're cooking and you're also tending to something for work related, you're trying to kind of mix between both. It's as easy as taking a step back, whether that means walking outside, whether that means stepping into a patio, into your own room, whatever you have accessible. If you're in, let's say at work, it may be stepping into the bathroom, right? If that's all you have
Right.
accessible to you. But just taking, even, it takes a minute, a minute or two, and just take those deep breaths while you're in there, but just separate yourself from that location or that one thing that's triggering you and you're feeling overwhelmed. And just you'll be surprised how even moving yourself from that location will make a big difference. And when you step out, it's almost like you're putting a pause button, right? You're pressing the pause button and you're
Mm-hmm.
saying, okay, I need a moment. I'm going to move to a different location, which by nature will trigger a different emotion, right? Hopefully one less stressful than what you're in. And then actually taking a break, a physical break, 2-3 minutes, right? Giving yourself a
Right.
break, maybe putting some water on your face, taking some breaths, and then coming back to that environment, but with a little bit of a fresher mind and not as escalated when it comes to the stress. So it's not always something that requires a lot of thought process or coordination to take these breaks. It's honestly as easy as just removing yourself from that location and giving yourself a minute or two.
And that also helps not only for those that are diagnosed with adult ADHD, but in any situation. I truly believe that, after studying this a little bit, resources and techniques, we can also apply these in our day to day. Not necessarily we have to have ADHD in order to apply these. And we talked about not sleeping disorders, but the importance of having a good night's sleep.
Mhm.
So can you tell me, can you expand a little bit more on the sleeping part? Because first of all, it's necessary. We have to sleep. And that's number two. No, number one. Number two is it's it could be a technique, maybe rest periods. But again, we have to be mindful that we are working class, right? The majority of us are working class. So how can we fit like a rest period, and have that 8 hours sleep that's recommended, or the 6 hours? Would that be enough? What do we have to look for when, with our sleeping patterns, in order to not trigger ADHD,
Yeah,
that
and this is kind of
diagnosis?
global, right? Like you mentioned earlier, a lot of these things we're looking at stress management, good sleep hygiene. That can be, to patients with anxiety an issue, patients with depression issue, but also an issue with ADHD patients. Sleep hygiene really comes down to a routine. We have it with our kids when they're young, or we set a nap time, a bedtime for them, a time which we wake up, and that applies for adults. That doesn't end, if you don't pay attention to that routine, it's very easy to start digging into that sleep hour. So let me do one more thing, or let me finish this
Mm-hmm.
one report, or let me go put the laundry away. That'll take just 45 minutes, but that's 45 minutes less that you slept, right? And so you're already starting to set yourself up for failure the next day. You're less restful, you're more tired. Obviously, your focus concentration is going to be affected as a result of that. So number one is setting a schedule and try to stick as close as possible to it. Of course, there's going to be, outliers, and there may be that one time that you have to push it a little bit for emergency sake, but trying majority of the time to stick to that schedule is important. So going but more importantly is waking up at the same time daily. That actually is more effective to set what we call a circadian rhythm, which is what we would consider a sleep cycle. So waking up at the same time daily becomes very important. On minimal, we want to look at like 6 hours. Most people can do okay with 6 to 8 hours. Of course, there's outliers that need that 9 hours or that 10 hours to feel well rested the next day. Anything less to 6, we're kind of pushing it, right? Even if you're someone who can do okay with less sleep, 6 hours is a pretty low cutoff there. So routine becomes number sleep, what you do before, right? So getting to bed, that time span becomes very important on how to essentially relax. So for a
Why?
lot of people, it is disconnecting. So off the phones, off the TV, not watching shows, and essentially taking away a lot of that media and that light exposure, and kind of promoting a
Interesting.
restful environment. There's a lot of studies, we've talked about it before, with the blue light that we have on our phones, on computers, on
Mhm.
TVs, that can be activated and can kind of mess with your ability to relax and to get to the point of sleep. So trying to limit that prior to that cutoff, that bedtime, becomes important. We usually say an hour is sufficient for that. So cutting that screen time an hour before is very helpful to maintain that sleep hygiene. Outside of that, going back to food, right? Limit the caffeine, nicotine, smoking as well in the evening. A lot of people know the caffeine. I think that's understood. Some people forget that nicotine as well can be a stimulant and can cause some issues with sleep, especially if let's say you smoke or use nicotine before bedtime. So that's something you want to be kind of mindful of. And kind of to the same tune, exercise, right? Exercise is good for you. However, if we put it too close to the bedtime, then obviously it can be somewhat of a stimulant. We talked about it releasing things like dopamine, serotonin. These can be stimulating chemicals, and can cause it or make it a little bit harder for you to feel tired, before bedtime, or may take a while before you actually fall asleep, which again cuts into that sleep amount that you get. So those are things you want to kind of look at. Other things that are helpful in regards to maintaining a sleep hygiene, especially in adults with ADHD. If you know you have issues with sleep, try some of the tips and tricks. So white noise makers, it's very popular. I'm sure you've heard of them. They come in all types of shapes, sizes. Nowadays, there's apps. Most of our phones come with the ability for you to make it to
Mhm.
work through a white noise machine if you plug it in overnight and keep it charged. But it does help kind of curb back some of those distractions, and helps people get a little bit more of a consistent night's sleep with it. And then, commonplace to that, just keeping sleep for nighttime, right? A lot of people are like, let me take a nap, and that nap turns into 4 hours, 5 hours. That's no longer a nap. You slept during the day. And so it's going to be harder for you to get a full night's sleep or be rested at night. So although naps can be beneficial to those that can maintain them very short, 10, 15 minutes, if you know you're not the type that can keep it that short, then
Mhm.
avoid them and then just keep your full time for sleep at nighttime.
What really surprised me out of the techniques for sleep was the TV, shutting off
Mhm.
the TV. I tell people, leave the TV on, you'll get bored and you'll fall asleep. So I guess I have to rephrase that. Shut off the TV and give yourself half an hour and then just close your eyes and
Yeah.
just try to disconnect. So thank you for that because I was selling it all wrong.
It's
I
a,
was
it's a twofold for TV. A lot of people like the sound, right? A little bit of the static. They almost look at it as
mhm,
white noise. However, the light and the content, because if you put a channel that's interesting to you, it's going to engage you, right?
right.
And so, of course, your brain is on. It's working. It's thinking what's going to happen next if you're watching a movie. So that's the opposite of what you want when you're trying to essentially wind down and get to sleep.
Definitely. I was just trying to put the boring part with the TV so you'll get bored and you'll fall asleep, but guess not. I was not looking at it. I wasn't seeing that part of this technique and how it does affect sleep. Now I understand a little bit more. Thank you for that, Melissa. So let's talk about strategies to manage impulsivity. I'm a very
Mhm.
impulsive person, but that's by nature, right? So and I'm loud and I'm very energetic. That's by nature. But on a person, on an adult that's diagnosed with ADHD, it could have its consequences. Um, so what strategies can you give us to manage impulsivity?
Yeah, impulsivity is, like you said, something seen across, it could be personality trait, it could be part of ADHD. Nonetheless, it's the aspect of doing things, kind of acting before thinking. And so the easiest way to even start to try to address the impulsivity is doing the opposite of that, which is pause and reflect, right? So before let's say on the to-do list, you have 10 things you want to do. And the first one is, let's say, go to the store, go food shopping. Rather than just getting into your car, going to the store to go shopping, pause and say, okay, if I know I'm going here, be mindful with it. So let me make a list. Let me go and see what I need, right? So you don't end up going to the store and buying whatever came to mind at that point. And then when you got home, you're missing majority of the things that you need, right? And you have to go back and waste time. So kind of putting a pause to it, reflecting, being mindful with what your next step is, becomes important to not get stuck in that impulsivity, because impulsivity, sometimes it's not effective. It ends up having you do things multiple times or the outcome isn't favorable. So we want to try to control that aspect of it a little bit. And if you do that with each step, let's say if you had those 10 things you needed to do on that list, then you're more likely, number one, to effectively cross that off the list and be able to see, completion of those tasks and not everything done halfway, which we see a lot with ADHD. Outside of that, I would say setting, to-do lists themselves, setting reminders, things that are visual, whether it be Post-it notes or obviously on our phones today, we have aspects to set reminders and alarms. That helps as well, kind of almost keep you accountable without it having to be from another person, but from the phones, which we carry with us anyhow. So that helps a little bit in regards to managing some of that impulsivity, because even if you're, let's say, have gotten a little bit tangential or done something that was out of what you were supposed to do, when that alarm rings, it'll kind of bring you back to base and say, oh yeah, I was supposed to be working on that, and redirect you again. So that helps. For those that do have, let's say, family members around us, friends, or live with people in the house that can help as reminders, that's always good, right? It's not always just the phone reminders, but it doesn't hurt to have kind of support when it comes to friends and family. Not that you need to rely 24/7 on them, but if they, if you educate them and let them know these are the things you're trying to work on that same mentality, they can kind of help you keep back on track, or just kind of check in every once in a while. So I think that's always important, to have a little bit support outside of just yourself. And
Absolutely.
then go ahead.
No, absolutely. I agree. And then?
Oh, and I was saying, just in regards to time management as it is, there's so many options now, and the phone is only one of them, but a lot of the times it does help to be able to plan to leave, to do things in certain areas. So if you're going to be at home, try to then do that to-do list of the things that are necessary there, and then manage to leave that house or leave that location, go somewhere else. Sometimes that change of scenario tends to help quite a bit, to just stop that impulsivity. Impulsivity a lot of the times comes from boredom. And switching up the setting a little bit sometimes will help to keep you a little bit more interested and less likely to be kind of forgetful.
I also want to thank the viewers and the listeners, because they make us think about what other important topics are out there that we can share, right? So thank you, Melissa, for being with us on the for my listeners and viewers, please hit the subscribe button. Remember to share with your friends and families. These are important topics. The subscribe button will allow you to keep up to date with our topics and what we're doing out there at Harmony United Psychiatric Care, right? Give us thumbs up, like our videos, and if you have any questions or comments, we welcome these. So please write your comments below, and we will make sure that we will answer all your questions. Melissa, again, thank you very much. Thank everyone for your support, and we will catch you on our next Harmony episode. Have a good one.